osteoid, osteoma, then it means the osteoid. It tells us the tumor is what kind of tumor? A bone forming. Okay? Okay, then when we say osteocyte, now you can see here, osteocyte. So cyte is always what? Cyte means a cell. A cell. Let's say erythrocyte, leukocyte, thrombocyte. Yes? When you have cyte, S-Y-T-E, that shows it's what? A cell. When we say leukocyte, it means it's a white blood cell.
Okay.
Yes? When we say erythrocyte, it means it's a red blood cell.
Okay.
Yes? That's what it means. Then, another term which is very close to osteo, but it's called chondro. It means cartilage. That means, for example, if you see here, okay, you can see they try to mark this area with bone. The one that with this is bone. Okay? And the one that is with this one, that is what? A cartilage. Okay? So cartilages are found in many areas of the body. For example, this area is a cartilage. That means our ribs are both bone and cartilage. Then if you see here the intervertebral discs here, can you see these ones? These are also cartilage. If you see the knee joint inside, they have menisci, which are cartilage. Our nose is a cartilage. Our ears are what? Cartilage. So most of these bones, like, okay, they have also cartilage. Okay.
So if you break your nose right here, is it not a bone or it's full of cartilage?
This part is cartilage, but the one that's okay is connected with the bone. The cartilage is connected with the bone. So can you see this one is the bone here, but the cartilage is on top. So here, this is the cartilage.
This is the top.
Yes, this one is the cartilage. So it's connected with the bone. So when we say chondritis, that means when the cartilage is inflamed, that's called chondritis. So when there is a tumorous condition of the cartilage, that's chondroma. Okay? So when you talk about the cells of the cartilage, it's called chondrocytes. So artery means joint, we discussed. So for example, arthritis, inflammation of the joint. Arthroplasty, always when you have the word, the suffix plasty, it means a reconstructive surgery. Yes, reconstructive surgery. Anything with plasty. Plasty is surgery. Let's say when you say arthroplasty, you can see artery is the joint, or is the combining verb. Plasty is the reconstruction. So when you do reconstructive surgery of the joint, that means when you try to change a joint with a new joint, then that's called, so that's replacement of joints with surgery. So you can have knee joint replacement, you can have hip, you can have shoulder. Yes, all of this. Okay? So let's say if you do hip arthroplasty, you see? Look here, can you see? Here the joints change it. So when you change both the bone and the joint surface both, then that is called total hip replacement. When you change only the head of the femur here, it's called partial. So that means this one is okay. This is called the acetabulum. This is the acetabulum. Where the femoral head is joining, that's the acetabulum. So, you see, if the acetabulum is okay, you don't need to change it. But if the acetabulum is okay, damaged, what do? You have to shovel it, and then you have to put the new acetabulum. Okay, so that's, look here how the hip is damaged. Can you see? Look, even look, there are multiple sisters here. Can you see these are sisters? Look, the joint space is narrow. Even no joint space around here. It's already sclerosed. How painful it is. Can you see?
Yeah.
It's so painful. So what they do is that they change this one and they change both the. So here, you can see here, can you see this is the acetabulum, the joint surface? So this is total. They change what? Look, they change the both of them. So that is called arthroplasty. So anything related with bone marrow is myel or myelo. Let's say myeloma, you see, myeloma is bone marrow. That means this is a tumor of the bone marrow. So usually this kind of tumor is found in the bone marrow. And look what kind of, especially if you see the skull is very characteristic, and it's called a punched out skull, or a punched out. It's called punched out lesion. Can you see this one here? Look, all this hole is punched like they punch the bone, like punch it. So it's called punched out lesions. So if you have this one, that is typical, the patient has myeloma. Yeah, myeloma. It means the bone marrow is really not good. Can you see? What's happening is that there is a damage in the genetic damage in the bone marrow, and there are what we call myeloma cells, which are abnormal cells will be formed. Basically, the plasma cells are the ones that are being formed, but here abnormal damaged plasma cells are being formed. And those damaged plasma cells, they lead to bone marrow, they eat the bone marrow, and they lead to what's called this myeloma. And let me check, sometimes also vanille. Yeah, this is what I want. It's called Bence-Jones protein. In the urine, you will get a protein which is called Bence-Jones. And if that Bence-Jones protein is positive in urine, that is multiple myeloma without any hesitation. It's called Bence-Jones protein. That's in urine. So a positive Bence-Jones protein shows what? Multiple myeloma. So now we have two clinical conditions here that shows multiple myeloma. What are they? One is the punched out lesion on the skull. So you take the X-ray of the skull. If that shows that Bence-Jones protein is positive, then that is a myeloma. Okay, so that is what we call myelo. Okay, teno or tendino or tendine, that is what? Related to the tendons. Let's say if you have inflammation of the tendon, that is called tendinitis. Or if you are doing reconstructive surgery or like corrective surgery of the tendons is called tenorrhaphy. Tenorrhaphy. So what's the difference between tendons and ligaments? Ligaments, they join bone to bone.
Yeah.
Yes. Let's say if two bones, this bone and this bone, to align, they are connected with a ligament. But if bones are connected with muscles, it's connected by tendons. That's the difference, okay? So that's why it says here muscle to bone, and here bone to bone. Okay? So tenorrhaphy, what you do will be, is trying to join the tendons. Yes? It's a surgical connection. Or look here. Okay. Most likely it might be lengthening of the tendon. They can do. Let's say there is contracture somewhere. If there is, let's say this hand is like this contracted. Okay. There can be different surgery that you can do. You can do surgery on the bones or the joints, and on the tendons. I mean, whatever the pathology is. Yes. So sometimes, if it is on the tendons, then what they do is that they do lengthening. Okay, that means you cut the tendon, and then you lengthen the tendon so that it will get. And then after that one, you do the tenorrhaphy. That means you attach the. So this one usually you can do it on. So this is called lengthening of tendons. Can you see here? Can you see? They are lengthening. Can you see? I mean, there are different techniques, but there is what we call Z lengthening. Z lengthening means this one here. Can you see? They cut the tendon like this. Z length Z like Z. So you cut here, you cut it here, and then you cut it here. So you separate. Okay. So you will slide one over the other so that you lengthen it. Can you see? And you attach it here. You stitch it there. Okay, that means it's what? It's now lengthened so that there is some kind, because if it's Achilles tendon, it's at Achilles here, yes?
Yeah.
If it's contracted, what's going to happen? It will be like this. So when you lengthen it, then it can come like this. So that's the purpose of these kinds of surgeries. Usually, there is what we call club foot. Do you know club foot?
Yeah, that's the.
In babies?
Yeah, babies.
Yeah. Club foot. There is what we call club foot surgery. I didn't
They do this kind of surgery.
Yeah, they do this surgery. I did some of these surgeries. So what you do, because it's contracted here, all the tendons on the medial side are contracted. So what you do will be you have to release all of those areas. So you
Yes.
It's contracted.
Yes, contracted. Why? Because all the tendons that are going here, okay, they are the ones that are. So what you do will be you have to lengthen them. So you do lengthening. You lengthen although, and then you correct it. And then you put on cast. You follow serially with the cast till it becomes like correct. And then that kind of surgery is called PMR, or it's called posteromedial release. That means you go to the posterior and medial aspect of the foot and you release all the structures. Okay, can you see? Posteromedial release. So you do here on this side, you release all the tendons, all the ligaments may be contracted, you cut them, and then, okay. If the child is grown up and if the bones are really grown, then you can do some bone correction. You cut some bones, especially on this edge. You see, this is a growing boy. Okay, there should be many deformities here, but you can, on this side there is wedge shape section. You cut the bone like a wedge, and then you try to create a space, and then try to bring the foot. That kind is called triple fusion. Let me show you if there is triple fusion. Can you see? Triple fusion means There are three joints here on the ankle area on foot. There are three most important big joints. What you do will be you take wedge shape of the bone. You cut like wedge part. Or we have here. Okay, see it? Let's say this is deformed like this. Yes. So you cut like this at the different joints here. There are different joints here. Okay, and then you try to correct. You cut the bone. You give space here, and then you bring it back here. And then you try to fix this one. You can see here, they put a screw. They put a screw here. Can you see? But depends on. Oh, look here. It says triple arthrodesis. That's the name. Triple fusion or arthrodesis means fusing the joints. You fuse the joints. Here the joints, you fuse them, or you just make them fuse. They no more. They don't have any motion here. Okay. They don't have motion around this area because almost the motion here is very mild. It's not that much. There is no like a big motion here. Huh? Anyone who has $20 change? In case any leftover money. Okay, you got it. This is called, you see, it's called triple fusion or arthrodesis. Now also from the joint name here, when we say arthrodesis, desis means when you fuse joint. Okay? For example, you can't fuse the knee joint. Okay, in some cases you can, if the knee joint is totally destroyed and you can't replace it with the other thing that you can't do is that knee arthrodesis. Let's see. Knee arthrodesis. So knee arthrodesis means, look here. So arthro is joint, desis is what? To fuse. When you fuse a joint, it's called arthrodesis. You fuse it surgically. Okay? So what is the disadvantage? I mean, it has advantage and disadvantage. You have to talk with the patient. You have to tell the patient you will not have emotion here, but the pain will go and all the deformities will be okay. And then you do.
So meaning that when this knee hits something, you won't feel anything.
Huh?
There will be no motion. Means
Yeah,
if it
you
hits something,
you can't move it.
you can't move it?
Yeah. Look how the joint is destroyed. Look. This joint, for example, you can't do it. The patient has severe pain on the side. So what do you do for that? The only solution is you cut here these two surfaces, and then you join them, and then you put it in some kind of. There are some pins here you put, and then you fix it like for 6 weeks. You put in cast, and after that you remove it. But the patient he cannot move the joint, the knee. That's called arthrodesis. It's a disabling procedure, but you do it only
Or the severe pain.
severe pain, and if you can't do arthroplasty, and in areas where she has pain here. What is he trying to do? Look, they have fused it. Okay. Yeah, arthritis, look here. Arthritis means all the joint surface is destroyed. Can you see? It's destroyed here, look, it's eroded. Can you see here? Erosion. So that is what we mean by this. Bursa means like bursa. It's a bug-like structure. And usually it's found around joints. Around joints. And inflammation of that is called bursitis. Okay, myo, we discussed that muscle. When we say myoma, is What's myoma? Have you heard of that? Myoma is a tumor condition of the uterus. When the uterine muscles get tumorous condition, it's called myoma. It's like this. When do you get usually? It's called in preemipara, preemie woman. That means who doesn't have any baby. And usually when your age is growing up, then you can get this one. Preemipara. So that's the advantage of having baby early.
Okay, so if you have babies early, you don't get the.
Usually, yes. But
prevents it from coming.
huh?
If you have babies early, it prevents.
Yeah,
it
it
from,
prevents, yes.
from coming.
Yeah.
Fibroid.
Yeah. Usually you don't get this one later. So here, can you see these tumors here? So there are different kinds. You look, some of them are in the muscle here. Can you see?
Yeah.
These are called intramural, inside the muscle. Some are hanging. Can you see? It's hanging. This one is hanging. Can you see?
Yes.
It's called It's like pedunculated. Some is like just beneath the surface here. Can you see? So there are different kinds. So usually they do surgery and remove those, but there is a risk of not getting a baby.
Yeah.
There is a very high risk of, even if you do surgery, I think it's very difficult to. Okay, so that is called a myoma. So look, these are different kinds of myoma. Can you see? These are pedunculated. Look, they are hanging on the surfaces. Can you see? This is in the muscle, intramural, and this is beneath the surface is submucosal. This is subserosal, here beneath the top layer. Do you want this? You want to print this one?
Yeah. Yes.
No joke with ladies' condition.
Yeah. What happened?
Huh? Yeah, so. Okay, I think when we finish this one, we'll finish, okay? I don't want to. Okay, can you bring it? Let's see. Okay, leave it here. You did it with pencil, yes? You did it with pen or pencil?
Pen.
You did it with pencil or pen?
I use
The pencil?
pencil.
Okay. Okay. Give it to her, okay?
Okay.
Give it to front desk.
It's okay, right? Pencil.
Yeah.
All right.
Give it to her, okay?
Okay.
And they will send it, well, we'll send it today, and then maybe they'll send it later in the afternoon. If you want the grade, you can either text me or call me, okay?
Okay. Thank you.
No problem. One minute, please. Can you change this one? Okay. Well, okay. Then Malaysia. Malaysia means when you have this term, then Malaysia means not the country Malaysia, it's Malaysia. It means softening. When the bone soften, for example, anything softening, you use the suffix Malaysia. So osteomalacia means when the bones are what? Softened. Chondromalacia, when the cartilages are softened. Okay? So,
No.
No, we didn't get that one.
huh?
We didn't get that one.
No, already I gave you the before, yes?
Didn't
we
pop
don't have
on.
the osteo- we have the
Huh?
My
porous,
osteoporosis, yeah.
You have
We
it
just
here?
don't have that one.
Malaysia?
Yeah.
So in those cases, I don't
can
know.
write it.
Yeah, just write it.
Okay.
So, osteomalacia is usually a condition of bone thinning, usually in adults. In adults. Have you heard of rickets?
Yes.
Yes.
So rickets is bone softening in children, or
Ah, yeah.
that's rickets. So the same thing in adults is osteomalacia. Usually the adult picture is so you see just like rickets, you will have bowing of the legs and different kinds of changes on the, so that's osteomalacia. When there is thinning of the bones, then the legs or the arms will get different position because they are thin, they can't bear weight. And in rickets also the same. If you see rickets, so in rickets there are different, let's see this one here, can you see?
Oh, that there.
Different things that can happen. Why is that? Okay, let's take this one. Yes. Look, all of these deformities, they can happen. They can have what we call Pigeon chest. Pigeon chest means their chest will be like this. It's deformed like this.
I think only in the legs before.
No. Yeah, you can have on the chest, called pigeon chest. And when you see here, they are called rosary spots. Here I don't see them, but rosary spots means, can you see these areas here where the cartilage and the sternum they join? They will have like a bony, stony, like swellings here. They swell. The cartilage, they swell here. It's called rosary spots. And the other one is, you see on the wrist, can you see here? Usually the wrist will become wider here. That's how even you check whether a child is, for the first thing you feel is you check this one. And it looks, the wrist is very wide, wider than usual. And you can't take x-ray. And if you see the x-ray, it has some changes. X-ray of wrist on rickets. Can you see here? Look here. Look how it's fraying. Can you see? It's called fraying. Look, there are like fraying things. Look, and it's swollen. Can you see? Okay? In children. Look how this is, look, okay? That's what you see in children. So that is called rickets. So the synonym word for adults is osteomalacia. We use we don't say rickets in adults.
Ah,
Yeah?
So it happens only children or adults too.
Yeah, and in both children and adults, but the children name is rickets. In adults is osteomalacia. So that's usually because of vitamin D deficiency. Yeah, in rickets. Another is when we say porosis, we mean porous. Porous means something has what? Opening. Yes? You know, like sponge. For example, sponge is what?
yeah.
A sponge is what? It's porous, yes? Why?
Because it's open.
Open.
It's because, and if you pour
Yeah.
water, it doesn't hold it.
Yeah.
It will what? It will lose. Yes?
Yeah.
So that is called porosis. So that's what it means, porous. So when we say osteoporosis, that means the bones are what? The bones are like porous, or they have some multiple openings. So usually So the other term, the best medical definition will be what's called osteoporosis is a decrease in what we call BMD. Decrease in BMD. BMD means bone mass density. A bone mass density. That means when there is a decrease in the bone mass density, when it decreases, then that is called, that is the medical definition, decrease in bone mass density. How do you check it? Especially there is what we call the, first let's see here, these are okay. So there is what we call bone absorptiometry. This is, can you see? This is absorptiometry, or it's called DEXA. DEXA. It's like, okay, DEXA means dual energy X-ray absorptiometry. It's called DEXA, dual energy X-ray absorptiometry.
Community scanner is it's If I asked you what a DEXA scanner was, I would wager you probably have no clue. In fact, I doubt Siri would even know. What's a DEXA scanner?
Okay, I found this on the web.
At least you got the scanner part right. But actually, a DEXA scanner is a little more sophisticated.
The DEXA scanner is it's DEXA. It stands for Dual Energy X-ray Absorptiometry.
What it's actually going to be measuring is bone mineral content, bone mineral density, and then we can also do body composition. So body fat, lean mass, those types of things.
The DEXA is the latest piece of high-tech equipment in Pittsburgh State University's Human Performance Laboratory. As far as we know, there's only 2 of its kind in our entire region, which really gives Pitt State students an advantage over other institutions.
Oh, it's so awesome. It's very exciting. I'm really pumped up about it. I wasn't sure what it was going into it. I mean, I learned about it in classes, but really getting a hands-on experience is great because you can read a book, but getting the real hands-on experience is what I really wanted.
Right now, we are going to be using it, number one, for educational purposes for our students, to get them hands-on training with a medical device, a diagnostic device. Secondarily, we're going to use it as a research tool. We won't teach them how to diagnose from it because that is outside of our scope of study, but we will get them trained in how to use the DEXA scanner.
The DEXA scanner is obviously a huge addition to the exercise science program at Pittsburgh State, a program that continues to see increasing enrollment numbers year after year.
I think that our program offers students the education that they need to pursue their goals, their professional goals, whether it be in physical therapy, occupational therapy, medical school, strength and conditioning coaches.
One of the biggest things that a lot of the students that we've had really like the possibilities. They're not locked into, if they don't get into this particular grad school or anything else, that they're not locked in that particular profession. They have options.
I chose to become a gorilla because of the exercise science program. I love it.
Okay, that's called, okay, that's how do you check the real osteoporosis. So what is the danger of osteoporosis? What happens?
Decrease mass density.
Yes, what happens if you have osteoporosis? Usually it can lead to what? Fracture. So the most common cause of osteoporosis is what we call menopausal. Postmenopausal. After the menopause, because of estrogen lack, then you can have bone. That is one of the causes. Usually it leads to osteoporosis of the femoral neck here,
Okay.
and then this bone can easily break.
Yeah.
That means you don't need a forceful trauma to break this. A trivial like injury, trivial movement, it can lead to break of this bone. That's one thing. And another area where you can have a break is you can have a break here at the wrist joint easily. This kind of fracture is called Colles fracture. Colles fracture. Colles fracture. It leads to a break. Can you see here? Here, why? Look, because the bones are thinned out. So these are the two areas. One is femoral neck, two is the Colles fracture here. Okay? These two areas, they can easily break. And that usually the most common cause is what we call postmenopausal. So you can see here, can you see deformity? Usually the correction will be, you might get a good correction with just manipulation that you hold, someone will help you, and then you pull this one, and then try to correct this area manually and put it in position, and you apply cast, and then you get a control x-ray. Let's see, maybe control x-ray. Control x-ray after the fracture is done. When the patient is in cast, you might get a control. Look like this, can you see? This is a control x-ray. Can you see the arm is bent? They try to bend it. Because in Colles fracture, it's going back, this one. The distal fragment here, this fragment is going back. So after you reduce it and you pull like here and then try to make, I mean, you can't get anatomical reduction, exact reduction. Yeah? And then you try to put this one in this position so that you see, you give like 3-point fixation. And it's good also if you put the cast up to here. Why? So that to avoid movement and so that this won't be loose. Another thing, maybe you can have also surgical for close Colles fracture, surgical. This is how you see how the cast. Can you see? Like this position, so that you have 3-point fixation. You see, if you are doing only, it can move. Okay, so if you do it like this, so you put the cast fixed in this position so that it won't move, and then you check the X-ray serially, like after 3 weeks, and so on. So here, really, can you see? This is buttress plate. Buttress plate. They try to do, but you see, you can't do it with we put lots of instruments here and so on. Really, it may be a little bit disabling. You have to remove them. The surgery is not really good. But the best treatment will be applying a good like cast the first time. If you have a good this one, I think you can avoid surgery. That is called Colles fracture. Look here, can you see how it's broken back? Can you see? Look, the bones are thinned out. But actually, okay, whose bone is this one? Is this an adult or child?
Adult.
Okay. Why do you say adult?
Because osteoporosis, most are adults.
Yeah, you're right.
Also in women.
Yeah, but this is a child bone.
That's a child bone.
Why? Because can you see here? This is the plate. It's not closed. The gross plate is not closed. Can you see? It's not closed. So he had actually, they call it here Colles fracture, but we call it usually Colles type. Usually Colles is for when you have in the elderly or when you're adult. Okay, when you're adult actually. But when you have in kids the same kind of fracture, we call it Colles type. It's like a kind of Colles fracture.
So what causes the
This one is he fell down in the school while he's running. Yeah, well, okay. He fell down here, then right over here, and then the bone. That's the common falling down injury. It's not because of simple trivial injury here. So this is typical how you do the cast. Can you see?
Yeah.
Okay. Then asthenia. Asthenia means weakness or loss of strength. Myasthenia gravis is a neuromuscular disorder here. Trophy means when something is what? Weakened. Let's say if your muscles are weakened, that is called atrophy. Okay, when you have hypertrophy, the muscles get what? Larger. Okay, increase in size is hypertrophy. Decrease in size is atrophy, you know? Because we said A is no, yes? Hyper when you get big. Algia or algesia means pain. So myalgia when you have muscle pain, arthralgia, joint pain, analgesia when you don't have pain. Okay, so these things we discussed them. If you want, I can print out for you if you need them. All of them actually we discussed them. So quiz is coming. Okay, let's do the quiz and then. At 12 we'll finish, okay?